Good afternoon, everyone. We're just going to give it a minute or two as we all trickle in, and we'll begin in just a second. All right, so welcome everyone. Thank you for joining us. My name is Katie Moreno, and I'm the Senior Director of Field Development at Autism Speaks for North and Central Florida. And we are so glad that you're joining us to learn more about the advocacy efforts of Autism Speaks, especially during this time of COVID-19. So I want to start by sharing our mission. Autism Speaks is dedicated to promoting solutions across the spectrum and throughout the lifespan for the needs of individuals with autism and their families. We do this through advocacy and support, increasing understanding and acceptance of people with autism, and advancing research into causes and better interventions for autism spectrum disorder and related conditions. So of course today we'll be focused on our advocacy efforts. We have an amazing panel that will talk about both the federal and state level work that we're engaged in. But before I turn it over to them, I just wanted to quickly introduce the local Florida staff. We have the pleasure of working closely with our volunteer committees and the communities across Florida. So I work with Tampa, Orlando, and Jacksonville, Florida areas, alongside my colleague Natasha LaMonica. And the South Florida chapter staff that's on the call today joining us is Lisa, Dana, and May Lane. And please feel free to jot our contact information down. If you'd like to learn more about becoming involved locally, how to support a local event, or learn more about the Autism Speaks Walk in your area, please connect with us. We'd be glad to speak with each of you. So now I just want to hand it over to Kelly Hedrick, the Senior Director of State Government Affairs and Grassroots.
Thank you so much, Katie. Welcome everyone, and we are grateful for your participation. We hope to bring you some valuable information today from a variety of vantage points. I want to start by letting you know we've been listening to a lot of family members, volunteer ambassadors, providers, and others in the autism community about the challenges that everyone is facing right now. We want to continue to hear what your challenges and concerns are. I just wanted to capture that some of the things we've been hearing and we understand are causing a lot of concern and difficulty right now are things including abrupt continuation of educational services. That obviously applies across the educational spectrum, but is especially relevant to kids and individuals with special needs, closure of day programming because of the shelter-at-home orders in many states, closures of clinics and shifts to doing the best we can with telehealth, mental health challenges for individuals and caregivers. You know, everyone is experiencing a certain amount of stress, and this is extra stress for the autism community, lack of connection to community opportunities and supports, severe disruption of community employment. Obviously, a lot of the population is affected, but there's a high rate of disruption for autism community employment opportunities, discontinuation of respite relief, disruption of much needed routines, loss of income for some families, challenging behaviors being exacerbated, and access to health care with appropriate supports being affected. So we hear you loud and clear. We're doing a lot to try to help with this, both as an organization of Autism Speaks and what our supports and services team is able to do, and also through the advocacy program with what government can do to help. We welcome your questions today in the chat box or in the Q&A box. We want you to know that you are muted and not on video for bandwidth reasons. And so we're not going to call on people with audio, but we do welcome your questions. Some questions that are very individual to your specific situation are best asked to our autism response team, those staff members. And so we will show this slide a couple of times just to let you know how to reach out to them if you have a very specific question to help your family. We welcome general questions or questions that may be applicable across multiple families. So please feel free to type them in whenever you think of them during the webinar. Our agenda today is going to be, we're going to have a federal update and then a state Florida specific update, and then hear a little bit about from our community outreach director about some services available from our organization. So for the federal piece, I'd like to turn it over to Dave, my colleague who heads up our policy and federal government affairs. Dave?
Thanks, Kelly. Great to be with you all. As Kelly mentioned, I work on the federal affairs side of things and based in Washington, D.C., or usually in our Washington, D.C. office, unfortunately, as everybody is at home right now. What I wanted to do is bring you through a high-level overview of what has been happening in Washington, D.C. since the onset of the pandemic crisis, and talk about specific bills that have passed, some challenges or issues that have come up for the autism community with those bills, and then talk about what our advocacy priorities are or have been throughout this process and going forward. So to begin, as you can see on the slide here, since the beginning of this crisis, Congress has taken action on several fronts to address a number of different challenges. I have it written here as COVID 1, 2, and 3. This has just been the general parlance or the way that people in DC have been referring to these things. They all have different fuller names, but COVID 1, 2, and 3 is kind of like the way that in Washington, D.C. speak, they've been referred to as. So, the first bill on March 6th was really right at the outset, and it was focused on providing more emergency funding for the public health response and several other provisions. And by the way, please feel free to put questions in the chat box or actually I should say in the Q&A box, or follow up with us after, because there's so much to all of these bills that I'm not going to be able to cover everything, but we're always happy to take questions. So the second bill, the Families First Coronavirus Response Act, passed on March 18th. And as you can see here, some of the top line provisions from that bill were providing emergency paid sick and family leave, some tax credits, free COVID-19 testing where that was available. Of course, I know there's been challenges, and several other provisions, including increased Medicaid funding, which is, of course, very important. And then March 27th, the COVID-3 bill, the Coronavirus Aid, Relief, and Economic Security Act, the CARES Act as it's called, passed. And that's the bill you have all heard about. It's the $2 trillion bill that provided $1,200 direct payments to individuals and $500 per dependent. These have been called stimulus checks. IRS calls them economic impact payments, but that came out of the CARES Act, as well as increased unemployment benefits, hundreds of billions of dollars related to the public health response, as well as providing money to state and local governments. The Paycheck Protection Program, which described here as the Assistance for Small Businesses. This was the forgivable loan program that was available to businesses under 500 to help ensure that they're able to keep folks on their payroll. Billions of dollars for schools. I know we'll get to this in more depth, that provision in more depth later on in our discussion, and extending the Money Follows the Person program through November. If you go to the next slide, please. Thank you. So, after March 27th, there was some additional negotiation on what to do next. There's still a desire in Congress to pass more relief and additional stimulus, but what was settled on, at least for this bill that ultimately passed on April 24th, known as COVID 3.5, was a very narrow bill. That Paycheck Protection Program for small businesses that we discussed, that I discussed a minute ago, it had been funded with $350 billion. Because of the huge demand for that, it ran out of money. The program ran out of money very quickly. And so what this COVID 3.5 bill focused on was replenishing that fund and then also providing some funding for hospitals and testing. So where we are now is that Congress is negotiating a future package to address a number of different challenges. Now, what is unfortunate for our conversation here is I can't tell you what's going to be in that. There's a lot of back and forth. While the Senate was in session this week, the House was not. It's supposed to be back next week, and it is likely that the House would be putting forward a bill first. And so, I listed a number of examples of potential items that could be included in here: public health response, more assistance for families and individuals. Money for state and local governments, and you see the list there. There's just a number of items that are not, that are here and that are not here as well. So if you could go to the next slide, please, Kelly. I wanted to just touch on a few things about what's passed already, and basically those first three bills in March, and talk about some things that have come up, in our in all of our discussions with the autism community. So economic impact payments, these were the $1,200 payments provided for each individual up to a certain economic income threshold, and $500 for dependents under the age of 17. So just to clear up some confusion, when the law initially passed, the IRS said that the $1,200 payments would go out automatically to anybody who filed taxes in 2018 and 2019. However, and again, at the time of this initial announcement, they said for those who didn't file taxes last year or this year, such as some Social Security beneficiaries, SSI beneficiaries, that they would have to go through a separate portal on the IRS website to be able to obtain their checks. There was a lot of advocacy around this, a lot of pushback, saying essentially that the IRS should be able to automatically distribute these payments and not make folks go through an extra hoop. And so fortunately, after hearing from a lot of people, they made the decision. They were able to make the decision to provide those payments automatically. There was an issue related to dependents not being able to get those $500 dependent checks for those specific individuals, those non-tax filers, and the IRS did require an additional hoop to jump through to get those, and they provided a very small window of time to do that, unfortunately. And again, happy to address more questions on that. The other issue I should bring up is that there has been a lot of concern and very much understood concern about the fact that the $500 dependent credits only went from age 17 and below, and not for dependents over that age. We hear you. We have been advocating on this issue. We've joined a letter with a bunch of other organizations in support of fixing this in future legislation. Distribution of education dollars, as I mentioned, we'll get into this more later in the presentation, but the high level of this is that there were three different pots of money provided for education in the bill that passed on March 27th, COVID-3. There's money for higher education, money for elementary and secondary education, and money for governors to use in a discretionary way to help where they saw fit. And we are advocating on the state level to be able to ensure that some of those dollars are spent to assist our community. But we'll get to that more later on. The IDEA waiver report, there was a lot of concern when some of the legislation in March was being drafted that Congress would waive protections for the Individuals with Disabilities Education Act. We opposed that idea that was floating around, as did many others. And what ultimately occurred was in the COVID-3 bill, there was a requirement that the Secretary of Education produce a report detailing any waivers that she thought might be necessary for Congress to pass. That report came out on April 27th, and the crux of it is that she did not recommend the waiver of any of the core protections of IDEA. So a good result in the sense that something bad didn't happen, but we know that there are still significant challenges that need to be addressed regarding education. And so while this was what we thought to be the right result of do no harm in that scenario, that there's still a lot more work to be done. The last thing I'll touch on is emergency paid and family leave. In the March 18th bill that passed, there were a number of criteria that were allowed to enable individuals to access emergency paid and family leave. One of them was if you are a caregiver of a child whose school is closed or daycare center, et cetera. But there was less clarity around whether or not the caregiver of an adult with disabilities whose usual source of care was not available, if they would be eligible as well. We advocated with the Department of Labor, others advocated with the Department of Labor. Fortunately, they made a clarification to ensure equity in that program. Kelly, can you please go? Yep, there you go. So what we've been doing throughout this process is doing a lot of listening, as Kelly articulated on that on the slide right before I got into my presentation here. We've been trying to have as much conversation, communication as we can. Judith and Kelly and Allie have really been spearheading those efforts for us. And what we've been trying to do is take what we've been hearing and bring that to Washington, bring that to our conversations with legislators. So the priorities listed off here are some of the things that we've been communicating. So additional funding for home and community-based services. This would be done in terms of a boost in funding through Medicaid for these specific services, and we would hope could be used for a wide range of things. Additional funding to meet the educational needs of students with autism. I think we are concerned in terms of regression that's occurred, and that we want to be sure that when students are able to safely return to school, that they are provided the compensatory services that are needed, and that school districts have dedicated funding to be able to address that. And so that's something that we're continuing to fight on. Protecting the rights of students under IDEA, again, I think a positive outcome with the Secretary's report, but we still will stay vigilant as the process in Congress, as any processes in Congress move forward. Everybody's been switching over to telehealth services for healthcare needs, while it's kind of a function of the situation we're in, we want to ensure that people have access and that it's done appropriately and serves our community in the best way possible. We touched on the eligibility for the economic impact payments and the paid sick and family leave already. And then also preventing discrimination in treatment decisions and care allocation based on disability. The Office of Civil Rights at HHS put out a bulletin that we thought was a step in the right direction in providing guidance and providing this information to healthcare providers across the country. Go to the next slide, please. Oh, okay. So let me just wrap up by saying thank you all, first of all, for participating today. We do have a letter that is being circulated in Congress right now by the co-chairs of the Congressional Autism Caucus, Congressman Chris Smith from New Jersey and Congressman Mike Doyle from Pennsylvania. And they, in that letter, articulate many of the concerns that we brought up in terms of the priorities that we've been fighting for in Congress. And while they initially sent it to congressional leadership, they've now opened it up for signatures for other members of the House of Representatives. And it's currently still open through the end of the day today. If you're interested in helping to contact your member of Congress, we can provide you that information on the letter and how to do that. So in any case, I'm happy to answer any questions and appreciate you all being with us today.
Thank you so much, Dave. And maybe we can put the link to the alert in the chat box. I think I did not include a slide that that covered that content, but we do encourage folks that are interested in reaching out to their member of Congress to see if he or she might be willing to add their name to that letter. So I really want to commend Dave and the other members of our federal team who have been working really hard from home, phone and email. They can't go to the Capitol right now, obviously, but have been really continuing to advocate in a sea of organizations that are looking out for, you know, whatever their interests may be in the COVID environment. It's hard to get through, but they just have been persistent and really standing up for the autism community. So kudos to their work. And my wonderful colleague Judith has been manning the chat and Q&A box. So we'd like to pause at this point and see if there are questions of a federal nature that Dave may be able to address. Judith?
Hey there. So Dave, I think, has been exceedingly thorough. And just a reminder, everyone, the action alert that Dave mentioned is in the chat box. So if you would all take a moment to make sure and take a look at that, please do so. If you have questions, please do put them in the chat box. We're happy to answer them. We did have a question about whether or not this presentation will be provided. It will to attendees after this is over. We'll send a copy of the PowerPoint as well as a recording. So that is coming your way. And I think with that, we can just give it back to you, Kelly, and you can talk with us about what's going on the state level.
Great. Thank you so much, Judith. And folks, continue to, if a federal question comes to mind, some clarification around anything Dave said or something that comes to mind later, I think he'll be with us for the duration, so he can take those later if there are any. So I joined Autism Speaks just a few months ago. We had a little bit of staff turnover on the state side of the team. I'm a Florida native. I'm from Gainesville. So I knew something about the state, but I have lived away from the state for a number of years. And I have been helped tremendously by Judith, who has been on the team a long time. We brought in a contract lobbyist, James McFadden, who's with the Southern Group, to help us out in Tallahassee. And the two of us are going to cover the state update. I'm going to start with James, who is going to cover some content about the where we are with the cycle of legislative session, the state budget, and some outcomes that are autism related, but actually coming out of the regular session and before the COVID period really hit. And then I'll cover some things that we've done since that happened. So James, we're very happy to have your representation and happy to have you join us today to share some information and potentially take some questions. So I'm going to hand it to you. Thank you very much.
Yeah, great. Thanks, Kelly. And hi, everyone. As Kelly mentioned, my name is James McFadden. I'm with the Southern Group. We're a lobbying and consulting firm that's based here with our main office in Tallahassee. That's where I'm located. But we also have offices around in all of Florida's major metro areas, as well as a few other states. So we're new to the autism, my firm is new to the Autism Speaks community as well. I actually just came on board in February. I'm really excited to be part of this advocacy family. And obviously the timing was such that almost immediately, I began assisting Judith and Kelly and the team with COVID-19 related issues, even though we were just beginning our legislative session. So since Kelly, as she mentioned, is going to be covering that, I did want to spend a couple moments talking about our legislative session. It concluded on Thursday, March the 19th. It was originally scheduled to end the previous Friday, March the 13th. Our session, if you're not familiar with it, is a 60-day session. It's actually pretty quick by state legislative session standards, so it's a bit of a sprint. But because of some trouble concluding budget negotiations, they did end up having to extend a few days to finish up on March 19th. Our legislative session actually usually starts in March, and since it's 60 days long, it actually normally would be finishing up probably tomorrow or maybe next Friday. But because the legislature has been experimenting a little bit the past few years with having session 2 months earlier during election years, and we have an election this coming November, we actually started our session this year in January. That timing actually ended up being accidentally really good because even with the needed extension to finish the budget, Florida was able to successfully conclude their session in a fairly normal way, while many other states are actually still in their sessions. And the pandemic has obviously drastically impacted those states' ability to finish their legislative work. So, we were lucky in that regard just by accident. Additionally, Florida's budgetary picture was prior to the pandemic a very healthy one. The new budget that was constructed during session this year goes into effect on July 1st. It did not have any Medicaid reimbursement rate cuts for providers. It saw nursing homes receive a rate increase and state employees actually receive a pay raise, both of those for the first time in years. Cash reserves were also beefed up to about $4 billion in total. The state set aside another $300 million or so this year to bring those reserves up to $4 billion. And of course, all this was done without knowing what was about to come. The state, but because of those cash reserves and because of the healthy budgetary picture that we had in our state leading into the pandemic, the state's already determined that it does not need to implement any cuts in the current fiscal year's budget, and our current fiscal year ends June 30th, because of any COVID-19 impacts. And it may need to convene a special session at some point to tinker with the new budget that starts July 1. Legislative leaders are signaling that, between the healthy cash reserves and the federal assistance that we just reviewed, that's coming down to states for families like you all, but also just for all types of different state functions. There's hope that budgetary cuts will be minimal for the new budget starting July 1, if they do have to make any cuts. Of course, all this is subject to change. A lot of it depends on how quickly Florida can get back to some sense of normalcy, considering our economy's dependency on tourism and sales tax for our revenues. As for legislation impacting the autism community, there were several bills we were following closely during session. Obviously, there's been a lot of attention the past couple of years on the Agency for Healthcare Administration. As many of you know, they've sought to change how behavioral analysis services are provided, how they're reimbursed. Thankfully, some of those ideas, such as some drastic cuts to reimbursement being floated, have subsequently been pulled back by the agency, really sort of at the direction of the legislature and because of the voices of the community that was raised. The provider community also, so let me focus over to the provider community for a second. They brought forward a piece of legislation this year that was also in response to something the agency had proposed. And that legislation would have exempted a group practice that provides behavioral analysis services from licensure and regulation as a healthcare clinic. Now, this is a requirement that has always been in place. It just never was enforced. And the agency, as part of their activities a year and a half, 2 years ago, began indicating that they would soon start enforcing that requirement for these group providers, that they be licensed and regulated as a healthcare clinic. That caught a lot of folks off guard, I think. I think a lot of folks didn't understand that they needed to be licensed in that manner. The agency understood it and gave them some time to come into compliance. So the bill that we were monitoring would have created a certification or would have exempted group providers out of that requirement and also would have created a certification process for registered behavioral technicians. Ultimately, that bill did not pass. However, the agency recognized the hardship that might create for providers, that clinic licensure requirement. And so in their own piece, and their own larger piece of legislation that we all call the agency legislative package bill, it's got all kind of stuff in it, about 150 pages. That bill did successfully pass, and that bill contained in it an exemption from licensure and regulation as a healthcare clinic, so long as that group provider was a Florida Medicaid provider. So that solved that issue for most group practices. So that was a good development, because that requirement really would have put a lot of folks probably out of business. And then finally, Senate Bill 82. This was a bill by Senator Aaron Dean. I think probably a lot of you are familiar with that piece of legislation. You may have read about it. You may have even advocated against it. But Senator Aaron Bean, he's the chairman of the Senate Appropriations Subcommittee on Health and Human Services. His bill was contemplating various changes to the iBudget program that's administered by the Agency for Persons with Disabilities. Despite there never being a House companion bill, the bill did successfully pass, which was a pretty rare feat. Normally there's supposed to be a bill in the House and a bill in the Senate that ultimately match up. There was a lot of stakeholder and media attention on potential reforms to the iBudget program entering the legislative session, as the Agency for Persons with Disabilities has historically struggled with operating within its budget. There's been a continuous wait list, obviously, for services. That wait list is numbered in the tens of thousands for years. And it's slowly been whittled down, but still there's 20,000 or so folks on that waiting list. So fear was circulating as we entered into session that the iBudget program would be decimated in an effort to cut cost or to control cost. Perhaps even it would be carved into the Medicaid managed care program. And the fact that the House was not showing its cards by filing its own bill also added to sort of the conspiracies about what was going to happen. But ultimately, the Senate and Senator Aaron Bean did lead the effort, and the House eventually agreed to take a lighter approach that would be designed to allow the state to better predict costs within the iBudget waiver program with minimal impact to existing service levels. The bill wasn't perfect, but it was definitely a much lighter approach than what was initially envisioned, and of course also didn't result in services being carved into managed care or anything like that. So, what did the bill end up including? Well, the changes included eliminating the statutory criteria for authorizing supplemental funding for a participant in the iBudget program, and instead of creating a standard definition of instead, it replaced it with a standard definition of, quote, a significant additional need to judge supplemental funding requests. And the bill also would centralize that process for consistency purposes at the Agency for Persons with Disabilities headquarters here in Tallahassee. The bill also included requiring waiver support coordinators to be employed by qualified waiver support coordination agencies. That was a bit of a controversial change, but that is included in the legislation. Again, I think that was an effort to try to gain some consistency across the waiver support coordinator community. Requiring all service providers to bill for services and submit all required documentation through the agency's electronic client data management system. Again, that's an effort just to modernize and also to assist the agency and again, getting a better handle on their budget and being able to predict budget swings so that they can try to avoid this situation they get themselves into every year with having budget overruns and deficits. And then additionally, the legislature did include a good bit of new money in the budget to fund additional slots in the iBudget program, try to take down that wait list that I mentioned. So the bill and the changes to the iBudget program that are contained within it don't actually take effect until July of 2021. So that's over a year away because there are some implementation things that need to occur and whatnot. So we'll monitor the implementation of the changes related to that bill and provide input and advocacy as appropriate. And that's my update on mostly non-COVID related state activities resulting from our session. And with that, I'll toss it back to you, Kelly.
Great. Thank you so much, James. And James will stay with us when we get to the end of this state section. We'll be happy to take any questions you may have on any of it. So towards the end of all that was happening that James mentioned, and our monitoring and determining whether to get involved in any of the legislation, or knowing all of the things that were behind the scenes, kind of let that play out. We were having careful watch over all of that. When the COVID situation hit and we started hearing what was happening federally, what the concerns were within the state, we ultimately zeroed in on a few areas to focus our efforts. These are the three noted here. Healthcare and telehealth specifically is one of the key areas. Home and community-based services, and special education, which is obviously a state and local issue for implementation. I want to just walk through some of the, this green is not wanting to advance. Here we go. I want to walk through some of the elements of this in a little bit more detail for you. When we share these slides, there are a number of live links in here that if those of you that are interested in going in and looking at source documents, you're welcome to do that. We're available for any follow-up questions you may have later. But telehealth was a key area because these are items that are really regulated at the state level. There's a federal umbrella, especially for Medicaid, and Medicare, around directives that come out of the federal agency that regulate those two programs. But a lot of the regulatory action of, may providers do telehealth in lieu of in-person appointments, visits in a situation like this? Can they be covered at the same equity, level as an in-person visit? Those are state-by-state regulatory decisions. And we wanted to be sure that even though telehealth isn't perfect, it often is better than nothing. And we encourage families that, may want to consider doing a telehealth visit for some autism services if they're not, to see how it may go. It's going to work better for some individuals than others, but the full range of autism related services. So we worked on both a Medicaid and private insurance authorization of telehealth. And for Medicaid, it's been fully authorized. It should be fully covered if your individual with autism is within Medicaid. Telehealth should be fully authorized. For those with iBudget waiver coverage, there is a little bit of a process right now that's playing out that updated the health codes that providers use to bill, and have a section of equivalent codes for telehealth visits versus the in-person. And they were proposing to do 30-day at a time service plans and have to renew after 30 days. There was concern by providers about the burdensome nature of having to redo that every 30 days. So that process of conversation is underway now, but that piece is specifically for iBudget waiver, and we'll continue to monitor that. If any of you are providers and have, or families that are being affected by any of this, we'd love to hear your examples, your stories about it to help inform the advocacy that we do. For private insurance plans, the Florida Office of Insurance Regulation is the appropriate entity that regulates. And while they did not have a mandate from that office or from the governor, there is a statement that encourages use of technology. And in talking to or in monitoring different large health insurance plans across the country, we have seen that many plans have agreed with that and offered up that telehealth coverage. But if you are finding yourself in a private health insurance plan where that is not being available to you, we'd love to know about it, and we can continue to advocate if it remains a challenge for families in Florida. So there are a couple of waiver related things that I'll mention within Medicaid that we created some requests around and statements on. So all states have applied for and received within Medicaid an 1135 emergency waiver through CMS. And it's just something that allows more flexibility related to authorizations and benefits in Medicaid health plans. And so it covers things like waiving certain provider screening requirements that are normally part of the bureaucracy, the process, postponing some deadlines for revalidation of provider credentials, allowing certain out-of-state providers to be utilized in Florida that would normally have more hoops to go through, allowing service provision in alternate settings, including those that are not yet licensed, suspending a fee for service prior authorization requirements, and extending existing prior authorization approvals for a longer time period. There's also a process that we learned of that is a regular part of Medicaid. It's called Appendix K, and it's intended to be used in an emergency, whether it may be a natural disaster like a hurricane that would affect Florida or a certain number of states, or whether it's something broader and nationwide like the COVID pandemic. And it is a waiver request that has a scripted process and form that state Medicaid agencies used. So it was completed and submitted by ACA and approved by CMS in April. This has state-specific further requests for flexibility and authorizing funding. If you're interested, this gets down into a really policy wonky, nitty-gritty level of detail that probably most of you won't want to see. But for those that may be interested, we wanted to provide the links to the applications and a related summary from the Agency for Persons with Disabilities. But I will cover the basics of what this Appendix K provides. And it's temporarily exceeding service limitations for certain life skills development and adult day training, as well as flexibility on locations. So allowing for some in-home, in the client's home, life skills development and training, temporarily allowing for payment of personal supports and services when a covered individual must go into the hospital, for example, if they have COVID and they're in the hospital, to allow payment of someone who can be with them to help, especially if they're nonverbal, have high needs. Retainer payments made to service providers in certain circumstances to keep them employed and on the contract, even if they're not being able to provide the services in the normal way. Allowing a family member to be paid to render services to a covered individual. Allowing other practitioners in lieu of approved providers in some cases. Allowing for virtual, so telehealth type evaluations, assessment, and person-centered care planning sessions. Adjusting prior approval and or authorization elements. And then allowing adult day program staff to provide some services in the home of the covered individual. Transitioning to special education and early intervention and transition. Dave mentioned the pools of federal education funds that were made available. The two categories of these funds that are relevant to special education, and these are Florida specific numbers of what the state is receiving, $770 million in the K through 12 category and $173 million in the governor's discretionary category. Those have or will come down and be available to the state to plug in to support school districts, counties in meeting unmet needs. There's some discretion to do some things at the state level that may be helpful as well. Our advocacy in this area has focused on, for the immediate time when students are still at home, making hardware, software, communication devices, other assistive technology, Wi-Fi, available for those students who need it to be able to do any kind of virtual school from home. We know that that's not always possible for all students with autism, but for where it's helpful to be sure that those services are provided. And then really focusing heavily upon the area of early intervention, the kids that are not getting the normal early intervention services, really hyper focusing on how can we create a plan as much as possible virtually, and then as soon as in-person is available again to work on that. Delaying the school start for those individuals if needed to have extra early intervention services. On the other end of the educational system, kids who are going to transition out, they may have finished their senior year in a sense because the last few months may have been waived, but if they haven't finished transition services to be ready to go into adulthood and potential employment for those that can't, extending that time period, letting them have another year or whatever, the 6 months to a year, whatever period of time would be most useful when that is possible, so that they can fully get those transition to adulthood services covered. And then for the main part of the student population, for services not rendered and to address the regression that has gone on, as soon as in-person is possible again, getting back to that, all the services and supports they need, even if it's during the summer and they might not normally be there, as soon as that opening happens to where in-person can happen again, to have a plan to really address the needs of special education students and have that the equivalent of an extended school year to the greatest degree possible, and utilizing the funds that may be needed from the federal government to be able to do that. So in here, we have a few additional Florida-specific COVID resource links that are to Florida agencies, the Department of Health, COVID-19 resource page, the governor's resource page, and the Agency for Persons with Disabilities website with COVID information specific to iBudget waiver program right there, front and central. I encourage you, if you're not already on our advocacy social media, here are the locations for that on Facebook, Twitter, and Instagram, and you can stay aware of all the things that are going on within those groups. And I'll pause here for any state-specific questions that have come up in the chat box or the Q&A. Judith?
Hey there, I think we are all set with the wealth of information that you've provided, Kelly.
Oh, terrific. Okay.
Yeah.
Thank you very much. Well, then I will go on. We have with us our colleague Janet, who is the Director of Community Outreach for a number of states, including Florida. She's out of the Atlanta area, and she is going to cover some of our Autism Speaks specific resources available to members of the community. Janet, welcome.
Thank you so much, Kelly, and thank you again to our amazing advocacy team. They work so hard with making sure that our families are taken care of and just providing us with all of the tools that we need just to have a better journey. I just share some information about what's taking place in our country right now, and provide you with some additional information and resources specifically around COVID-19. And, just to say that since this pandemic had hit our community, Autism Speaks, we have taken very, very swift action, to the immediate needs of people with autism and for their families. In response to the news of the rapid spread of COVID-19 among our communities, as we just talked about, we've urged lawmakers at the local, state, and federal levels to take immediate action to protect our communities. If you visit autismspeaks.org, on that homepage, you will see a yellow banner that drops down, and that banner will actually link you to some additional resources that is available. So, life, it can be very, very difficult right now, and we know that it can be especially hard for autistic people. So, with what's happening around the globe, it has forced us to adapt as best as we possibly can. We are confronted with radical shifts in our schedules, having to utilize different modes of communication, changes in social demands, and increased safety risks, which is causing us to, wear a mask and social distance from one another. This pandemic, it has imposed adversity in the form of challenges with health, economic stability, and our overall general well-being. As concerns and the fear of the unknown rise about the spread of COVID-19, Autism Speaks just wants you to know that we're going to be here to fulfill our mission, to listen to the needs of families and the autism community, to provide, guidance and support, and create useful tools and offer a sense of community at a time when it's needed more than ever. And I just want to share information, as you see here, about our autism response team. They are a group of highly trained employees of Autism Speaks. They answer questions through email, through chat, through Facebook, answer calls and all of that, just to help provide you with resources and tools that you would need to help navigate your autism journey and to provide additional information. Just a little bit of background about the Autism Response Team. In 2019, they helped tens of thousands of people through those one-on-one conversations with specialists trained to provide information about autism-related programs and services across the lifespan. And some of those services are right in your backyard, and they would help you to identify where those services are for your family. We also have an autism response resource guide that contains a database of thousands of local services and resources. We also have free downloadable toolkits, like a transition toolkit. There's an adult toolkit. We have toolkits on a lot of different things, over 40 free downloadable toolkits that are available on our website, and you can just download them for free and just help support. So again, if you need help or if you're in need of financial support, our Autism Response Team is available to connect you with any grant opportunities that are available and other resources as well. Their contact information is listed here on the screen. You will get a copy of this presentation after it's over with. But, the Autism Response Team, they have seen an increase, they're seeing a marked and increased calls. Autistic adults are losing their jobs, and there's an increased need for mental health resources, which is also on the rise in the autism adult population. Parents and caregivers have become teachers, and they're looking for help amidst disrupted routines, and there's an increase in challenging behaviors as well. We also are online answering questions from over 2 million followers on social media in real time and bringing that information to the masses rapidly. And so as COVID-19 continues and as the economy recedes and people are facing unemployment at unprecedented volumes, to combat this crisis, Autism Speaks, we are developing an employment ecosystem of programs to support autistic students and job seekers, employers and service providers through a digital training series and through virtual coaching for autistic employees. Despite the rise of COVID-19, Autism Speaks continues to expand our outreach efforts with the community. So we are listening and we are learning, and this will enable us to not only understand what some of those unique needs are, but also to assess a catalog of valuable resources and tools to respond quickly and provide aid. So since schools are closed and families have found themselves facing numerous obstacles, we've put together wonderful videos and tools to have families adapt to these sudden changes in their routines. And so go to the next slide, please. And finally, as Autism Speaks, we've developed these resources to help those in search of answers and questions related to caregiving during COVID-19, and also provide those that are seeking to learn some quick supportive techniques. We have this information that are available, and so you'll be able to click on these links to provide you with that information. So we've also compiled, and we will continue to update in real time, a list of information from the Office of Human Services and Resources Administration, from the Department of Education, from the National Association of Community Health Centers, and from the CDC. So these resources are available on our website 24 hours a day, 7 days a week. Some of those resources include an Ocali autism internet modules. Ocali is an autism, those internet modules are a series of free online trainings on a variety of topics, and they provide high quality information and professional development for anyone who supports, instructs, works with, or lives with someone with autism. And so we have all of these resources available. Feel free to visit our website, and the information is there. So no matter what, we just want to encourage you to hang in there. We're always here to help and provide you with the help and resources that you need. And so at this particular time, I am going to turn it back over to Judith, for final comments and answer any questions.
Thank you so much for the terrific work. Thanks, Janet, for the terrific work you do. And yes, Judith, if there are any final questions, we'd love to take them now.
I think there are some follow-up questions on state advocacy, Kelly, that we can answer after. We've got some really good questions here that we need to answer.
Terrific.
So, but I think we're good with Janet. She was so thorough in her presentation too. So thank you all.
Terrific. Well, we're almost at the hour, so we will do that. We will get back to the individuals with state-specific questions. Judith will share the questions with us, and we'll take care of that. We will send out the slides with links and the recording. And we want to thank you all so much for taking the time to spend an hour with us today and hear this information, and encourage you to stay in touch. Have a great rest of your day, everyone. Thanks so much.